So, dear colleagues, we will start now, and I would like to introduce our today's expert, a very famous expert in the world of Ayurveda, one of the most citated. So first of all, Dr. Ram is a founding director of ADP Research company from India, which is about 75 years old. Dr. Ram is also scientific director, right, of research director, I'm sorry, of Amrita University for Ayurveda, where they are using modern molecular biology technologies test the effectiveness of Ayurveda. And Dr. Ram also has many students, and this year we are planning to get our first our postgraduate student together to do some research work. But first of all, personally for me, Dr. Ram is my teacher in Ayurveda, and he's also scientific advisor of our Ayurvedic association, and he's helping us to develop Ayurveda here in Russia.
Итак, чтобы не затягивать и передать слово нашему гостю, я скажу, что существует три большие проблемы, с которыми неизбежно столкнется аюрведа как область знаний в любой стране, в том числе и в России, если она хочет быть внедренная.
And before I give the word to Dr. M, I would like to mention that there are three problems that Ayurveda will face before being accepted in any country, and Russia as well.
And thanks to Dr. Oleg for the warm introduction. And it's a great pleasure for me to be here today and to discuss about the possibilities of what Ayurveda can offer, to manage musculoskeletal diseases, which we will discuss today, and diabetes, which we will discuss tomorrow. I think it's the fulfillment of an old Indian dream that Ayurveda should spread all over the world and help people to attain longevity and happiness. Because Ayurveda is a gift to the world, and it's there in the name. I think of all the medical systems in the world, the name Ayurveda is unique. Because today we have traditional Chinese medicine, traditional European medicine, traditional African medicine, and all these kinds of traditional medicines known at the place where they are practiced. But you can see Ayurveda is not known as traditional Indian medicine. It's known as Ayurveda, which means the knowledge of life. And the founders of this system did not call it as Indian medicine, because life is seen not only in India, and the knowledge of life has to be everywhere on earth where there is life. So the principle is that wherever there is life and there's biodiversity, there will be Ayurveda. And I think it today is also the proof that in a very cold part of the earth like Siberia, there's the possibility of Ayurveda, because there is life and biodiversity in spite of the snow and the cold.
Потому что здесь, несмотря на снег и холод, есть жизнь.
So Oleg talked about some challenges, in bringing Ayurveda into Russia and also maybe Europe and other parts of the world. And I agree with his observations, the three critical, points that he raised. I said that I agree with what Dr. Oleg said, that there are those three critical challenges that we have to overcome before Ayurveda can, get accepted. Yes, I mean, we use technology to make things simpler for us, but sometimes makes things more difficult. Yes. Yes, so I'm saying that I agree with what Dr. Oleg said, that there are those three great challenges, we need to surmount before Ayurveda can move all over the globe. But I would like to also point out a deeper challenge, which is really at the heart of the problem of Ayurveda not being accessed worldwide. So the knowledge of Ayurveda has two elements. One is the universal principles, which applies everywhere. It is insights into the basic nature of the human being, the basic laws of nature, which are applicable anywhere in the world. But then we also have the other element, which is actually the local application of these principles, which will be different depending on the climate, on the geography, the culture, and the variations that we see in humans. And so, like for example, in Ayurveda we have dietary and lifestyle, and diet is a very important part of the process of healing. But if you look at the lifestyle and diet that is followed in India, it's not applicable in a place like Siberia, for example. So it would not make sense to bring some of the practices that are followed in India into a place like where we are now. So it means that we will need to do some preliminary studies and understanding of, how nature behaves in this region, why certain types of food are important here, why certain lifestyle modifications would be very unique to this part of the world. And these are things that we need to work out. And it's a principle in Ayurveda that biodiversity creates an ecosystem, and that in each geographical region, nature provides all the necessary materials, which we have to discover and use to achieve higher health. So also for this reason, we cannot bring only herbs from India to solve the problems of the world. India also does not have so many herbs to supply to the whole world. So this means we have to study many of the plants that are available in different regions and then use them on the basis of Ayurvedic principles. And I think this is the real challenge of translating the principles of Ayurveda to the different locations of the world. So the second point, before we go into the topic today, I wanted to discuss is about how Ayurveda views healthcare in a very comprehensive manner. Ayurveda believes that human life is complex. That one approach will not be able to give us a complete understanding. And Ayurveda believed that human experience, multicultural human experience, has to be brought together to weave a very comprehensive approach to healthcare. So, for example, a textbook of Ayurveda written perhaps 3,000 years ago, mentions that there are in the world different approaches to healing. So it's called medical pluralism. And Ayurveda was a very early system to recognize that people will create different ways of healing. And the text asks this question, how do we know which approach is better? Which medical approach can we say is the best amongst the many that are available? And this textbook called the Charaka Samhita was one of the earliest medical literature in the world to talk about integrative medicine and an evidence-based approach to bring them all together, to help humans achieve higher health and well-being. So, I also would like to say that what Ayurveda offers is an integrative framework. It's not that Ayurveda is coming as an additional element into the modern world, and we don't know where to put it. like if I tell, let us have Ayurveda, you may wonder, now where can we put it in this institute, for example? Where will it fit in? But Ayurveda is the framework to fit everything else. So it's not where you will place Ayurveda, but where everything else will fit into Ayurveda. Because Ayurveda is like a big container which gave an outline of all possible ways in which humans explore healing. It has been documented from mind-body medicine to chemical medicine, to the use of poisons, to the use of manipulative techniques. Everything is accommodated and accepted in the framework of Ayurveda. Yes. And in fact, Ayurveda also includes the approaches of modern medicine. We can make better use of modern medicine with the framework of Ayurveda. So I would like to present Ayurveda as a tool which we could use to develop, a new integrative approach to health. And for this we need to do certain steps. Is first to translate the universal principles of Ayurveda in a language that can be understood all over the world. And second, see within these principles how Ayurveda relates to other approaches to healing. Because Ayurveda is a matrix, a multi-leveled matrix. So an Ayurvedic physician is supposed to understand the meaning of any healthcare intervention. He cannot say, this is outside my domain. I mean, Ayurveda says energy medicine. We must have a view on what it is, why people use it, where is it helpful, where is it not helpful. And so as we do this translation, we should also be able to discover specific ways. I call this as global localization of Ayurveda, not globalization, global localization. So that what we will have here, for example, would be Siberian Ayurveda. Because in India, we also have Kerala Ayurveda. So people may ask, is it different from Indian Ayurveda? It's called Kerala Ayurveda because the people of Kerala in recent times did that work to use Ayurveda in a way that is more suitable for Kerala. So it became so successful that people wanted Kerala Ayurveda. So when I was in the US, I saw some clinics named as Kerala Ayurveda. Yeah. So I wondered, what is Kerala Ayurveda doing in the United States? So then some of the people there said that we want Kerala Ayurveda because it's the more effective Ayurveda. And so I told them that Kerala Ayurveda is not going to be helpful for you. You need to discover American Ayurveda. Kerala Ayurveda is good when you are in Kerala, but not when you are in the United States. So Ayurveda is also one of the systems which looked into all these challenges, all these paradoxes in medicine, cure with compassion, mind versus body, pharmacological versus non-pharmacological, cure versus care, because medicine is always engaged, in conflicts when it comes to many of these elements. Today, overemphasis on cure has led to dehumanization of medicine. So Ayurveda always emphasized that these are continuum on which we need to bring a balance. There should be care and cure. There should be pharmacological and non-pharmacological. There should be mind and body. It's very dangerous to, miss the balance. And I think that is also the challenge of medicine today. We have so many tools available today than ever before. We have some of the most sophisticated, mind-boggling technological, interventions and tools available. We can just move organs from one body to the other. Mm-hmm. We can make biological systems come to a complete standstill. We can stimulate stem cells. I mean, whatnot. There's no limit to what we seem to be capable of doing. In fact, if you go into such a technologically sophisticated medical hospital, you might even wonder, what can we do with Ayurveda? But the beauty is also that alongside such sophisticated technology, we are also seeing the rise of complementary and alternative medicine, which offers an entirely different approach, which is based on more subtle energies, on ideas of balance and harmony, opposition to the control and manipulation that is offered by modern technology. Mm-hmm. So I just wanted to give this introduction before we go into the topic. the emphasis that Ayurveda has an inclusive, not an exclusive approach. So we are not going to say this is better than everything else in the world. It's all about how we can use what we have in the best way possible. And that's the philosophy of Ayurveda. Now I will get into this topic, the musculoskeletal diseases. And before that, I would like to summarize what is Ayurveda in four statements. So, first of all, Ayurveda is like a mirror. Because the fundamental principle in Ayurveda is the evil is important. And conveying this message is the first step in healing. The foundation for health is meaning, the self-appreciation that I am a precious presence in this universe, that every individual is unique. And Ayurveda is like a mirror which reveals this to you. Because Ayurveda tells you why you are what you are. We must work not against our constitution, but with our constitution. So Ayurveda is perhaps also one of the earliest person-centered, personalized approach to medicine. So we are not treating the disease, but we are treating the person. So we are not treating musculoskeletal diseases. We are treating persons. Two persons with the same disease may be treated in two different ways. Modern medicine is based, all modern research is based on the premise that if a medicine works in one person, then it should work on everybody else. So that's why we do clinical trials. But Ayurveda says that what works in one person may not work on the other person. And knowing this difference is the crux of learning how to heal in Ayurveda. So looking at Dr. Oleg sitting here, I'm reminded of heart rate variability. Until recent times, we thought that the heartbeat was just lub-dub, the same thing. But now we know that between two heartbeats, there are untold stories. Every heartbeat is a witness to the entire changes that happen in your physiological systems. So this study of variability and variation is at the center of Ayurveda. So we will not only look at musculoskeletal diseases in general, but how Ayurveda weaves person-based approaches, which will be customized and made very specific to each person. So the first process in Ayurveda is looking at the mirror, recognizing oneself, where we stand. And then Ayurveda says that every life form comes with, just like any device, if you buy a computer, it comes with a manual, a user's manual. The first step, as I said, is identifying the constitution, understanding how each individual is different, so that even if we are affected with the same disease, we realize how we have to modify treatment for that person. The person is important here. His sickness, his suffering, everything else is, going out of focus. When the Ayurvedic physician sees a patient, he sees the individual, his concerns, his aspirations. So, if at the end of the consultation, you are not feeling, you don't discover yourself, then you cannot initiate Ayurvedic healing. Yes, when you have an Ayurvedic consultation, you end up discovering yourself, how self-worthiness. Okay. And the second thing which Ayurveda says is that just like any equipment that we buy comes with a manual explaining how to use it. Like if you buy a phone, if you buy a computer, if you buy a washing machine, then you can see a manual which tells how to operate, what switches to, switch on or switch off, and how to store. There's an entire user manual. So first is Ayurveda is like a mirror. The second is it's like a user's manual. Today we know more about how to use gadgets and devices we hold in our hands and less about our own bodies. We are very ignorant about how we should maintain our own bodies in a very healthy manner because we have not read the user's manual. And the user's manual is specific for each person. So when you discover yourself, discovering yourself is the key to open the user's manual. It's locked with your fingerprint. So now we cannot read it because we are not using our fingerprint. So even the Ayurveda doctor cannot take your user's manual unless you help him with your fingerprint. So this is the process of diagnosis in Ayurveda. We discuss with the person, with his help, find out his unique constitution, and then everything becomes clear. Oh, so you need to do this lifestyle, you need this diet, you need this medicine, because it's all there in the user's manual. Now we got the key. So once you start using the user's manual, you will find that the body is a self-servicing device. It's got a tremendous ability for self-servicing or self-regulation. So once you discover your fingerprints and open the user's manual, then you can activate all these self-service mechanisms. And only if these 3 steps fail, you need help from outside. So this is, in a nutshell, the Ayurvedic approach to disease and healing. So now we will start our discussion, and I'd like to just open the floor for a little bit of interaction. Maybe any questions at this point? And how many of you are already aware of Ayurveda? And a few things like that, so that I can bring the right focus when I discuss. It's a little bit good to know about how you are also thinking, so that there will be communication better.
Yeah, very diverse.
Very diverse,
audience.
yes.
Yeah.
Different levels, okay. So, but did what I say so far make sense? So, I hope now we are all the same level.
Сейчас, по крайней мере, мы все примерно на одном уровне.
Yes. Do you have any queries at this point? Because I just tried to give a very general introduction to Ayurveda. Your expectations, what you were looking at from this course, and how we are moving. Because now I'd like to go into some technicalities of how Ayurveda approaches musculoskeletal diseases. Yes, of course, we are all diverse. That's what Ayurveda also states, that each one is a very unique point of, universal energy, bubbling and manifesting in a very special way to make that very special contribution to this world before they disappear. So, that's the potential we have to discover. That there's something special I have to do. And doing that is also important for me to discover higher health. Okay, so today we will deal.
So just one comment from Oleg. The main expectation or query would be understanding of clinical protocols for treatment and processes.
Right. So that's what I want to try and give, and how Ayurveda would approach this disease. Which are the challenges in bringing those clinical protocols here? But we don't have time to go into too much of depth, but still I have a lot of slides which will indicate that, there are many more things to kind of discover. So, when we look at musculoskeletal diseases, so we are talking about joints, ligaments, muscles, nerves, tendons, all the supporting structures of the body, which help us to, position ourselves and also move about, and it's so important for mobility and, productivity. So when you talk about musculoskeletal system, we are talking about stability and mobility at the same time. So yes, these are the structures which are involved with the musculoskeletal system. And we know that they are responsible for fundamentally 2 things, stability and mobility. So if you say muscle, it's for mobility, and the skeleton is for stability. It's also very interesting that we chose this as a first topic, because this system is so fundamental for all human productivity and creativity. Yes, and so the impact of musculoskeletal diseases, of course, affect our ability to keep ourselves stable and mobile at the same time. And we look at 3 major challenges that are posed by musculoskeletal diseases. One is trauma or injury, which compromises our ability to be stable and mobile. I mean, the outcomes are always the same. We get compromised, we're not able to be stable or mobile. I mean, in any musculoskeletal disease, this is the eventual outcome. But it could be due to trauma, or inflammation is another important element that we have to target when we're dealing with musculoskeletal diseases.
Или воспаление.
And then degeneration or wear and tear. So these are the underlying mechanisms that operate in all musculoskeletal diseases. So we could also look at other conditions like infection, and there are other mechanisms that may also be involved in creating musculoskeletal problems, but we're going to look at these three major things today. So, you know, it's very interesting that these three processes also correspond to the three pillars of the body, which in Ayurveda is known as the three doshas. I don't know anybody who has not heard about the three doshas. Everybody knows?
Никто не слышал.
Yes, but maybe. What I have understood is that a lot of people today know these doshas by name, but not by full insight. There are a lot of misconceptions and a lot of different ideas about what the doshas might be. And a very narrow way of understanding it is as wind, phlegm, and bile. So this is a very unfortunate translation, you know, that the doshas are just, you know, the wind that forms in your stomach and the phlegm that you throw out of your mouth, or the bile that you might vomit when there's too much of acidity and liver problem. Actually, the doshas represent the dynamism of matter-energy transformations. Matter, energy. So everything in nature is in a flux, is in a movement. Energy turning into matter, matter again turning back to energy. And every cycle, every moment, if you break it, they are all built out of endless such transformations.
And
every moment, if you break down the universe into moment, M-O-M-E-N-T, you know, you break it down 1 hour to 5 minutes to 60 seconds to microsecond, you can see in the existence of the universe, even in a microsecond, there is a transformation of energy and matter. So we say the three doshas are the unit of life. The doshas represent the unit of life. The three doshas unit of life. Because in every small thing you will see this you know, movement of the doshas. So there is the potential energy in the form of kapha, which represents, you know, the preservation of energy as matter, and it is the structure. Yep, energy. You know, energy is potential and kinetic. Potential energy is, you know, conserved energy.
That. Can you repeat the whole sentence?
Yes, so what I was saying is that you can see that every process in nature represents the movement of energy into matter and matter back to energy through a process of conservation, transformation, and utilization. So it means that for anything to happen in nature, there has to be this cycle. One cycle has to happen, that some matter has to be taken, transformed, and utilized. So that is the three doshas. Kapha is conservation, Pitta is transformation, and Vata is utilization. So it's one cycle. They are not three separate things. It's a cycle. So there are microcycles and macrocycles. And every microcycle is a representation of a bigger macrocycle. So if you look here, you know, trauma or injury, we are talking about structure. And inflammation is a transformatory process. And this is degeneration, which is, you know, utilization. So Ayurveda looks at these problems as imbalance of the three doshas. And this is what we mean, you know, structural instability, functional instability, and, you know, a complete disuse of the body. Yes, so, you know, what I was saying is that when there's trauma and injury, the whole focus is on the structure, damage of structure. A sudden damage to a structure, that's what happens in trauma. So it corresponds to kapha. Is that connection? Yes. And when we talk about inflammation, it's now a process. It's a process of repair. We know that inflammation is a response from the body to repair and re-establish the balance. And that is pitta. It's transformational. And when you look at degeneration, it happens because of overutilization. So what we call as repetitive stress, wear and tear, we use a joint repeatedly for a same purpose, then it develops degeneration. So because it's overutilization, it corresponds to vata. So you can see the three doshas, how they influence our ability to maintain our stability and mobility. So Ayurveda teachers were also poets. So I also like to talk a little bit in poetic language. So I say ability, stability, and mobility. So we lose the ability to maintain our stability and mobility. So that is the picture of musculoskeletal diseases in Ayurveda, and we already see what do the doshas mean, in terms of what happens in musculoskeletal disease. So trauma, of course, today, I'm not going to deal with that more because it's more practical oriented, a lot of procedures, surgery and all those things, but I will briefly mention what is Ayurveda's take on trauma and injuries. Today we know that surgery has advanced to such an extent that we can even fix micro vessels, nerves, even if the limbs are severed, we can fix them back together using advanced surgery. So this is amazing. But what Ayurveda says is that the injury is not just physical. There is a deeper impact when there is trauma. So it's not just like fixing the limb back, just like, a machine. While that is important, there is what we call as the prana, or the flow of energy in the body, which gets a shock when there is trauma. And this can have also an impact into your psychic system. So in Ayurveda, trauma is just a physical damage to a part of your body, but it's much deeper. It has an impact on your pranic field as well as on your mental field. So while you do the surgery, we also need to do certain other treatments which will stabilize the pranic field and also, normalize the mental stress that has a deep impact during this trauma. So apart from that, there are also other physical treatments that can be done which can speed up the entire process of healing. The body becomes completely ready to handle that recovery from the trauma. And this is a very important supplementation that Ayurveda can do to modern surgery. So even the amount of bleeding that happens, the chances of infection becoming, life-threatening, the chances of a severe inflammatory reaction coming over a wound, all these things, can be controlled and stabilized with the Ayurvedic approach to manage trauma. And so there can be faster healing. This is also very helpful in what is called as the post-traumatic stress syndrome, which is also a big problem in military medicine. Many of these soldiers, they take many, many years to recover from the deeper impact of the trauma. So I just want to show that there's a big potential area of integration in trauma medicine. If you bring Ayurveda, and Ayurveda would mean also many similar techniques used in Chinese medicine and many other systems of the world. In principle, they are the same. And I want to give an example how in a big allopathic hospital in Delhi, one of my friends, this hospital is known as Medanta, they are using Ayurveda to help patients recover faster after robotic surgery. Robotic surgery. We use a robot to do the... So there was a thoracic surgeon who was doing, thoracic robotic surgery, and he found that a lot of his patients had post-traumatic pain and They needed longer hospitalization, and so
Например,
and by using Ayurvedic treatment after robotic surgery, they could discharge the patients much faster, much more quickly. So so this is about trauma, and just a small idea about what Ayurveda can help. So Ayurveda was one of the beginnings of surgery was in Ayurveda. Many people do not know that. Sushruta, and his name is there in many medical libraries around the world. So he was a pioneer in developing surgical instruments,
и он был пионером в разработке хирургических инструментов.
As well as surgical devices, and they number in hundreds, and we still use most of them. Scalpels and lancets and probes and, so many such other surgical instruments. They were all developed by Sushruta. And he developed the sharpness was the ability to cut the hair into two. That was the standard of the sharpness in those days, that you take a hair and then with that instrument you must be able to slice it, not this way, longitudinally into two. And Sushruta also practiced antiseptic surgery because he used to sterilize surgical instruments before. So surgical sepsis was unknown in India. Infection after, and there was a very nice documentary by Dominic Vujastic on the contributions of Sushruta. It's there on YouTube. Vujastic is from Poland. But he's a renowned historian of Indian medicine. And he says that at a time when surgery was like butchery in Europe, Sushruta performed mind-boggling surgeries without any infection or, good recovery. So he was also the first surgeon to use biodegradable sutures to close the intestines. Yeah, so what I wanted to say was that today we would say Sushruta surgery has developed really very well. So we don't need an alternative for that. What we need is the supportive care for trauma. And that Ayurveda has tremendous contribution to play. So we have here some of the inflammatory diseases which we will discuss very briefly. So was this clear about how Ayurveda can contribute in trauma? And I want to tell at that point that we also have, very similar to Chinese medicine, the concept of vital points which are called as marmas. In Ayurveda, marmas are not just energy points, they're also physical structures. Because Ayurvedic texts clearly say what is a marma, whether it's a muscle or a bone or a nerve or a tendon or an artery or a vein or an organ. It's very clearly explained. So this is interesting difference between Chinese meridians and Ayurvedic marmas, because these meridians are purely energy points having correspondence to organs, but in Ayurveda these marmas are physical things. So a lot of structural corrections, physical alignment, these therapies are also part of Ayurvedic rehabilitation after a musculoskeletal problem. So rehabilitative medicine, trauma recovery, these are all potential areas where Ayurveda has a lot to offer. So now we will look at some inflammatory and some degenerative diseases, and I will try to quickly give an idea about how Ayurveda will approach these diseases. So here we have gouty arthritis, rheumatoid arthritis, and also ankylosing spondylitis. So we know gouty arthritis is seen more in males, in rheumatoid and more in females, and ankylosing spondylitis has also a genetic background. So we can already know that it's not the same for everybody. These diseases do have some preferences or rather susceptibilities. I was saying that these diseases have a tendency to affect certain types of people. And Ayurveda is trying to tell us why it affects only some people and not everybody else. Like, for example, in gouty arthritis, we know that uric acid levels in the blood will increase. But all people who have high uric acid level do not get gouty arthritis. So it's only one aspect. So this is why Ayurveda is focusing as to why in some individuals it becomes gouty arthritis, while in some individuals it does not. And that is the focus in our diagnosis and treatment. I'm just trying to show how Ayurveda has a different on these common conditions. And if you come to rheumatoid arthritis, 3 females to 1 male, that's a ratio. And generally women in their middle ages tend to get rheumatoid arthritis. So, and why does this happen? And these, here Ayurveda gives very interesting insights which help us to develop personalized approaches to healing. And similarly, and rheumatoid arthritis, I may give you some additional information because I was involved in a clinical trial with funding from the National Institutes of Health, which is the first ever, rigorous clinical trial done on Ayurveda. And if you look at ankylosing spondylitis, again, so we know that people who have the HLA-27, genetic factor are said to be susceptible to ankylosing spondylitis. So there's a genetic predisposition. But not everybody who has this also gets ankylosing spondylitis. So that's a point I want to make, that today we do not know, like it looks like gouty arthritis is such a general disease, but it is not. Even with our limited modern understanding, we know that it happens only in some individuals. There's a gender variation, there's a genetic predisposition, but still we do not know why some people get it, why some others do not, why some people respond better, why some people do not. So these are the mysteries, and these are exactly areas where Ayurveda gives interesting insights. And then so is this clear? Is the pace in which I'm moving is okay? We're able to follow? Yes. So then we look at 3 degenerative diseases. In detail, we look at only one each in each category. Osteoarthritis and rheumatoid arthritis. So osteoarthritis, cervical spondylosis and lumbar spondylosis affecting the neck and the back and the knee, hip and hand joints. Actually, they are all osteoarthritis. So when we have osteoarthritis of the hand, we call it OA of hand. Osteoarthritis of knee, osteoarthritis of hips, and then when it's osteoarthritis of the vertebrae, we call it as lumbar or cervical spondylosis. So we can also call it as cervical osteoarthritis or lumbar osteoarthritis in principle. So here also, what is interesting from Ayurveda's viewpoint is we know that if you take the x-rays of all of us here, we might find that many of our x-rays indicate already lumbar or cervical spondylosis or even osteoarthritis, but not all of us are having symptoms. A lot of people have radiographic changes without having any physical symptoms. This is a field where it's notorious that radiographic or MRI changes do not always correlate with clinical presentation. So why do 2 people with almost the same structural problem present in 2 different clinical ways? This is what I have seen again and again in my practice. If you just were looking at the images, you would imagine that they will all have the same. So this is why Ayurveda says that every person is different, even when it comes to a disease. My cervical spondylosis is different from another person's cervical spondylosis. I have my special cervical spondylosis. So we can fight each other saying, no, it's mine is different. I have another special type of cervical, not the one that you have. With almost the same modern diagnosis, we'll get slightly different treatments from the Ayurvedic physician. So here modern medicine it just does not have explanations. It just leaves it like that. And just by stating that clinical symptoms don't always correlate to radiographic findings, so there will be in the lab, in the report, please correlate clinically. What I was saying is that in modern medicine there's not an attempt to go deep into why these differences are there, but it's recognized that there are differences. It's just mentioned that you must correlate clinically. But in Ayurveda, we look into the why of this difference. And that why of this difference is the basis for our treatments. See, for example, if you have a Vata constitution, your osteoarthritis would have a different course, a different evolution than if you were a Kapha constitution. If you are a Pitta constitution, then your osteoarthritis would develop in a slightly different way. So a Vata constitution person is more likely to develop osteophytes much more quickly.
Например, люди...
Osteophytes are bony outgrowths that you can see on an X-ray. And so it will be much more painful for them. And a Pitta person would have also mild concurrent inflammation, leading to some swelling and, in the joint. So we can identify from an Ayurvedic viewpoint how these things are differing and why. And in a Kapha person, the presentation will be different because there's more weight, and because of the weight, the deformity, the bowing and knock knee, and yes, these things can happen more in a Kapha person. So in this way, now there's not just 3 constitutions, people can be classified in many ways, and then you go into a lot of details, and each person now begins to look very different. What I said was that human constitution is not just Vata, Pitta, Kapha. There are many combinations and permutations. And look at all those things. You already now you can see that it's no longer just osteoarthritis. It's a very big and different story. Each patient comes with his own story to tell. And this difference is the most important aspect of Ayurvedic diagnosis and treatment. So you will see later what kind of treatments we give in some of these conditions. So maybe you come to our hospital and you see osteoarthritis patient 1 comes inside. She gets some very harsh herbal powders made into a bag and bang, bang, bang on his knee. And another osteoarthritis patient comes and we are gently applying some paste. So you may wonder, the doctor likes this person better than the other. He's banging one person and then gently, but it's not. It's because the doshas are different. So in one, when there's Vata and there are these harsh osteophytes, you do a different treatment. When there's slight inflammation involved, then your treatment is slightly different. So the dosha classification gives you a tremendous insight on how individuals respond to the same disease process in different ways. Is that clear? So now we quickly go through these conditions from a modern viewpoint. I will not take much time because this is just for refreshing our minds. And we will actually go to the 2 diseases in detail. So I will be a little quick with the slides. So we know that, gouty arthritis is caused by excess uric acid in the blood, and this uric acid may form crystals and get deposited in the joints, and then it leads to very severe inflammation, and then we call this as gouty arthritis. And today we know that the dietary element is very crucial in the development of gouty arthritis. People who drink a lot of alcohol, meat, and these are the presentations: a nighttime attack of swelling, tenderness, redness, sharp pain, especially in the big toe, and then it can also affect other joints. So today corticosteroids and non-steroidal anti-inflammatory drugs are used to manage gouty arthritis until the crisis is overcome and the symptoms subside. So in modern medicine, the whole focus is on suppressing the inflammatory reaction from the body by the use of corticosteroids or anti-inflammatory drugs. But in Ayurveda, the approach is opposite. We don't attack the body because we believe that inflammation is a healing response. So if we keep suppressing inflammation and all these immunoreactions, your immune system will become weakened in the long run. So Ayurveda does not agree to this approach. So the Ayurvedic approach is to help the body to complete the healing process more effectively. So there are 2 approaches here. So weakening the challenge, that's principle 1. Because there is some factor which has activated the immune response, the inflammatory response. So for example, the uric acid and the crystals. And the medicines will, scavenge and remove these things, its excessive accumulation from the body, and then naturally the inflammatory response will become more. So I'll go into a little bit more details later. And now we come to rheumatoid arthritis. So from inflammation we go now to immunity. If gouty arthritis was more inflammation, now rheumatoid arthritis is an autoimmunity. Autoimmunity is your own immune system attacking yourself. So it's an immune response where your body destroys the joints through this inflammatory, and actually the joints can be destroyed. Erosion of the joints can set in very quickly,
Эрозия суставов.
leading to deformity and complete collapse and crippling effects that, it causes deformity, very painful. And it's such a debilitating disease that today the whole focus is on early detection and using, chemotherapeutic agents like methotrexate or biological therapies. The whole goal is on preventing damage to the joints by early treatment. And while in modern medicine, we do have some powerful medicines today, which if we take very early, there's a good chance that a lot of patients can achieve remission, a lot of people can prevent damage to the joints. Yes, but there are two challenges. There are a lot of people who don't respond to any of these treatments. And when they do respond, sometimes they get very severe side effects, especially if they need higher doses. And so there are still a lot of challenges in modern medicine. So we do not know why again. Some people respond to methotrexate, some do not. Some respond to biological agents, some do not. And many of these biological agents are also very expensive, extremely expensive. And we were able to do a study with a very eminent rheumatologist from the US. And we were able to show how, with a individualized Ayurvedic therapy, we can achieve the same results as methotrexate with fewer side effects, but with a longer period of treatment. And now if you look at ankylosing spondylitis. So it's again a form of arthritis. It basically affects the spine, causes the spine to fuse and become stiff, and then you're not able to move. So this can also sometimes cause systemic effects. Systemic. It's affecting the whole body, not just the joints, or sometimes the lungs or the heart may all be affected. So people can become wheelchair bound with this disease very quickly. So we have had experience in preventing the progress of this disease and also reversing. We have had people coming in wheelchairs and then, walking out of the hospital. So it's been amazing to, work with some of the patients who had ankylosing spondylitis. So then we have osteoarthritis, which I already described. So a lot of people are affected today. And some of my colleagues in Germany recently did a very rigorous clinical trial. It was done in Berlin at the Charité Medical University. And they found that individualized Ayurvedic treatments were 3 times better than the allopathic management. So in modern medicine, we have painkillers, and some of the biggest problem for conditions like osteoarthritis is long-term dependence on painkillers, which can cause gastric problems, kidney damage, and here Ayurveda has a tremendous contribution to make. We have been able to prevent a lot of unnecessary surgeries. We have been able to... I get excited. So the next 2 slides, I hope you can read it. I will not tell everything because it's already translated, because otherwise we will not have time. This is only for, So similarly we have cervical spondylitis. So here compared to osteoarthritis, the biggest challenge is we have also neurological problems, like neurological deficit, which will be the additional challenge, and this is the modern understanding. So because of the narrowing of the the intervertebral disc space through a process of degeneration, there can be disc prolapse, formation of osteophytes and pressure on the nerves, spasm of the muscles, it's a big syndrome. So, and the outcomes can be from pain and disability to severe neurological, deficits. And we will look at how Ayurveda, approaches this problem. No, what I was saying, yes, is that, there's basically a degenerative process. The discs begin to get dehydrated, and then it becomes, shrink, or it may bulge, or it may prolapse, herniate, and then it puts pressure on the nerves and causes stiffness to the muscles around the region, and maybe severe pain, restriction of movement, or sometimes that could be sciatica, or the pain in the nerve that passes down to the leg. So these are all various problems that are presented, and even severe neurological problems. I think it's all mentioned there. So next is cervical spondylosis, which is also very similar. Sorry, it's lumbar spondylosis. I just talked about cervical, which happens at the lumbar region. It's a very similar process. Now, in modern medicine, in all these conditions, it's physiotherapy, and then painkillers. So a lot of people, again, have to take a lot of painkillers and do physiotherapy, which works for some people get worse. And these are 3 diseases which come to Ayurvedic physicians in India, quite a lot of them. And they are preventing surgery, we are stopping painkiller use and helping to rehabilitate them. Physiotherapy is much better if you do it along with Ayurveda. I'll come to that point also. So we know these diseases. What I wanted to explain is that these are well-known diseases in modern medicine. There's a lot of understanding about the pathology, but what is lacking is clearly the understanding of the different ways in different individuals manifest and express the disease. And that is where Ayurveda has a lot of role to play. So I'm not talking about Ayurveda as a complete replacement of modern treatment, but how bringing in Ayurveda can completely transform, the treatment experience. How we can prevent the unnecessary use of pain medications, and how we can prolong or even prevent the need for surgery. How we can find safer alternatives for anti-inflammatory action and quicker healing, and how even physiotherapy can be made more powerful and more effective. This is what we will discuss in the remaining section of how an Ayurvedic treatment protocol will completely change our experience of treatment. So, of course, there are a lot of things to discuss, and we will not be able to do everything. Now, after that introduction, I would like to go into details of how Ayurvedic treatment is done in specific diseases, and we have rheumatoid arthritis. So I want to start with a study which we did in my own institution. And as I said, this was funded by the National Institutes of Health, USA. And we had a very eminent rheumatologist from the University of California, Los Angeles, to work with us. And his name is Daniel First. And he is involved in the development of the diagnostic criteria for rheumatoid arthritis, the ACR criteria. He is one of the authors of the EULAR ACR 2010 criteria for diagnosis of rheumatoid arthritis. So this is the first time such a clinical trial was done to study the effect of Ayurveda in rheumatoid arthritis. So we had 3 groups in this study.
Let's go 3 groups.
And you can see the color here, blue, red, and gray. So one group receives methotrexate, the allopathic medication. The red one receives Ayurvedic treatment. And you may ask, what is Ayurvedic treatment? It's not one medicine. Each person receives slightly different treatments. As I told you, based on the principles of why one person gets one medicine, another medicine. And third group gets both Ayurveda and allopathy. Now, we have Ayurvedic placebos and modern allopathic placebo also. So it was a double-blind, placebo-controlled, randomized clinical trial. And we had a lot of challenges to develop placebos for Ayurvedic medicines because they had smell and taste, but we did it with the help of, some food additives. We made placebos. So it's the first time such a study was ever done for Ayurveda. So we had this rheumatologist coming from US. He would do the diagnosis based on allopathic parameters, and then they would be seen by Ayurvedic physicians. And Ayurvedic physicians would prescribe treatment based on the Ayurvedic principles. Each person gets a different prescription. And when we finished our study, we found no two persons got the same prescription. There were many common things. So on the one hand, we have only methotrexate for everyone. On the other hand, each person getting a slightly different. So this was a very unique study for the first time comparing two approaches like this. It was a 9-month study. And because usually the study is only for 6 months, but we knew that Ayurvedic medicines take longer to work. So we said we need longer time to assess. And the results were very interesting. You know, this is ACR 20% improvement.
ACR?
Yeah. So I hope all of you are surely aware of the criteria for improvement in rheumatoid arthritis. The American College of Rheumatology criteria for 20%, 50%, 70% improvement. So this shows how many people achieved 20% improvement, and this shows how many people achieved 50% improvement, and this shows how many people achieved 70% improvement. So you can see after 6 months, this is the Ayurveda group, the red one, a lot of people achieving 20% improvement. So you can see the Ayurveda people achieved, more number of people in the Ayurveda group achieved 20% improvement. If you look at 50% improvement, you can see the allopathic group was higher than Ayurveda, and Ayurveda was the least actually. If you come to 70% improvement, now allopathy is definitely superior, Ayurveda is 0, and the combination is slightly better. So if you stop the study at 6 months, you say allopathy is definitely superior, and Ayurveda can give only 20% improvement. So one of the biggest decisions in the trial was to have a 9-month study instead of 6 months. As you can see, at 9 months, Ayurveda group has 100% 20 under ACR 20. Everybody achieved 20% improvement. And allopathy and combination are almost similar. If you take 50% improvement, Ayurveda and allopathy are almost same. But now if you look at 70%, Ayurveda has the highest. So from 6 months to 9 months, there was a big change. So it's the story of the tortoise winning the race. Story of the tortoise. You know the story of tortoise and the hare, the rabbit and the tortoise running race. And okay, anyway. So, you know, it's very clear, this is the first time that any or other medicine other than the modern, you know, DMARDs has been clinically shown to have same effect with much fewer side effects, very negligible side effects. So what we found, so what we learned was that the combination had very poor performance. So probably it is not good to combine the two. And this group had the maximum side effects. And the second number of side effects was in the allopathy group, and the least side effects in the Ayurveda group. So the first time we were able to demonstrate that Ayurveda could offer a better long-term disease-modifying anti-rheumatic drug. So now you may ask, what did we do? And that's what I want to discuss in the next minutes. So there is a proof already that it works. And we got the best rheumatologists in the world to come and check whether it works. And we got an award from Europe. It's the first official recognition of Ayurveda in Europe. So the Excellence in Integrative Medicine Research Award. And also, Edzard Ernst, who is a very strong critic of complementary alternative medicine, he says everything other than modern medicine is just placebo. But he recommended our study as a blueprint for future studies on chem. So, the proof was obtained for a protocol. And now I will try to tell what is that protocol. So, there is not I want to say there is not a single medicine. Ayurvedic treatment is based on certain diagnostic considerations, individual specifications of the patient. So that is the first step in deciding the treatment. Okay, this is all reviews. So systematic reviews, and this is our publication. So this data, this is just information if they want to cross-check, so it's not for discussions. Yeah, now some of the slides, I will not go into detail because, we want to go into the treatments, but I want to say that diagnosis is the key thing first, because we have to know how I must do a different treatment for a different person. That is the key in the success of Ayurvedic treatment. What I was saying is that the diagnosis is the key thing in Ayurvedic diagnosis, not the allopathic diagnosis. See, suppose you tell me that this is rheumatoid arthritis because ACPA is positive or CRP is high and it meets the ACR criteria for rheumatoid arthritis. I cannot treat. There is no treatment in Ayurveda for ACPA, or we don't know what it means. So I would say, I don't know, show me the patient, then I can see what I can do. So I forget what is rheumatoid arthritis. In Ayurveda, what we need to know is understand two conditions called Amavata and Vata Rakta. There is not enough time to go into the details of these two conditions, but I want to give a very quick explanation and show how, according to the diagnosis, we will derive a treatment. So, the key thing here is factors called Ama, which is, a compromised state of the metabolism, causing immunological stress and a lot of, inflammatory responses from the body. Ama, you can consider that as a compromised state of your metabolism. And there are many metabolic byproducts that can trigger, inflammatory and immunological responses. So we call the condition as Amavata if there are signs of this metabolic imbalance. And if that Amavata signature is identified, then we have to do a specific treatment for Amavata. The other condition is Vata Rakta. And for this we need to understand some Ayurvedic concepts which is not possible to explain completely in a short seminar, but I hope you can consider it as another factor. So we're just looking at which factor is dominant, the Ama component or the Rakta component. Is that clear? At least that much? Yes. So when Ama is dominant, we have a more acute manifestation. You can see in rheumatoid arthritis there is a chronic phase and there's also the acute phase. So in the acute phase, when there is more Ama, you need to do a certain type of treatment. And when that Ama phase is gone and when it's more Rakta dominant, then you have another type of treatment. So we can say the treatment generally proceeds into three phases. The first is dealing with Ama, which we say is the basis for the immune response, the autoimmune response. And then the Rakta, which deals with the inflammatory responses of the body. And after dealing with these two conditions, we go to Vata, which is bringing structural stability, recovery of the joints, rehabilitation. That is the management of Vata. That is the last phase of the disease. So when a patient comes to us in Ayurveda, we classify them into these three phases. So are we dealing with Ama or with the Vata Rakta component, or are we dealing with a more advanced, stage with deformation, where rehabilitation is important? So on the whole, we believe that, there are many conditions in joint diseases, and rheumatoid arthritis most closely resembles what have been Ayurveda as Vata Rakta. So we have to do a clinical assessment of the patient and confirm that from an Ayurvedic point of view, it really matches the criteria of Vata Rakta. So that is the first step. And then we have to determine the locus of Vata Rakta. So because in Ayurveda, Vata Rakta, I don't know whether I'm making sense, that rheumatoid arthritis does not correlate with any single condition in Ayurveda. It does not correlate with one disease in Ayurveda. Vata Rakta, you can say, are actually, diseases of the connective tissue, autoimmune diseases of the connective tissue. Together is known as Vata Rakta in Ayurveda. So it would include systemic lupus erythematosus, scleroderma, many other conditions in which the same pathological process is involved. And only that Vata Rakta with a focus on joints we can call as rheumatoid arthritis. So we go through these stages, confirm that it is Vata Rakta, what is the locus of Vata Rakta, and then see the dosha dominance. This is the most important part of our diagnosis. To see the same patient with rheumatoid arthritis may present in slightly different ways. And when we analyze this presentation, we understand in some people it is Vata dominant, in some people it is Pitta dominant, in some people it is Kapha dominant, or in combinations there will be a variation in the dominance. Is that clear? So we can have a rheumatoid arthritis patient who in Ayurveda would be Vata dominant Vata Rakta, and in such patients there can be very quick development of deformity. So if we see a patient with Vata dominant Vata Rakta, what is the clinical significance? We can predict that these patients are likely to develop deformities much quicker than others, like swan neck deformity, or the fingers going to the sides, and this can happen much faster in a Vata dominant Vata Rakta. And of course, by doing certain specific treatments for such patients, you can prevent that progress. So we give more attention to preventing deformity in Vata dominant people. So in our study, those patients, all of them were rheumatoid arthritis, but those patients who showed Vata dominant Vata Rakta were given slightly different treatments. In these people, what happens is the swelling and inflammation, they don't stay for long. They very quickly change into damage and deformity. Yeah, you will not find that the inflammation or swelling is remaining for a long time. I mean, it will very quickly damage the joints and they will begin to develop deformity much faster. And in Pitta people, there will be more profound inflammation, redness and tenderness. And this can cause systemic effects. There are systemic effects of chronic inflammation. And rheumatoid arthritis is also known to cause systemic effects. Like there are new studies which show that even rheumatoid arthritis is making a person susceptible to cancer, heart disease, and other problems. So the Pitta dominant Vata Rakta is likely to create such effects on the body. So our treatment now will be not only to balance the Pitta, but to prevent those outcomes on the body. And if you have a Vata dominant Kapha dominant Vata Rakta, and then there will be more prominent swelling. The swelling will be more dominant. It will take long time for the swelling to go away. The progress is a little slow. It doesn't damage the joints as fast as in Vata or Pitta types. Yes, you can see there's more swelling. The swollen joint count will be higher, whereas in Vata the painful joint count will be higher. And in Pitta generally it will be. So by looking at these patterns, this is very interesting. So we have been doing these clinical studies. A lot of allopathic practitioners said that these differences could be seen, but they are not given any clinical significance. I mean, treatments are not modified based in allopathic medicine. I've not seen doctors changing treatment because of these presentations. Is this clear? One way of differentiating? So we check whether it's Vata Rakta, and it's Vata Rakta affecting only the joints, and then the dosha dominance, and now we must look at also the constitution. So if a Vata Rakta is there in a Vata person, it will be more disastrous. If it is in a Kapha constitution person, the Vata Rakta, it's not as dangerous as it happens in a Vata person. Is that clear? So the same disease happening in different constitutions will have different outcomes. Yeah, so if a patient comes to me and I find out he's Kapha person and he has a Kapha type of Vata Rakta, so then I tell him, you're lucky. Your disease is going slowly, so we can relax. I have some time to treat you. But on the other side, I see a Vata person coming with Vata Rakta. And I would say, oh, please, you have to be very careful. I mean, your joints are going to get damaged very quickly. We have to do something immediately. So we have to do aggressive treatment. So what we found in our study was when we classified patients like this, we found so many subgroups of Vata Rakta. In Ayurveda old texts, they talk about 70-80 types of Vata Rakta. 70-80 types. No, that is there, doshas. I'm talking of Vata Rakta. Vata Rakta. But I'm so glad to know that you looked at Sushruta. Yes, the dosha classifications are very complex, yes. So, this is the key thing in developing treatment protocol, that we found that when we classified patients into these groups, in allopathy they all was one group on one side, everybody one, but in Ayurveda it got split into so many groups. So now our treatment is specific. For Vata Rakta, one approach. For Pitta Vata Rakta, one approach. For Kapha Vata Rakta, one approach. Kapha Vata Rakta in Kapha person, different approach. Then depending on the stage of the disease, if it is in the Ama stage, if it is in the Rakta stage, and Rakta stage, 3 stages. So the acute, Ama stage, then the chronic Rakta stage, and then final debilitating Vata stage. So in this way, by considering these factors, we change the treatment. So I cannot give one treatment protocol for this disease. So if you ask me which is your herb that is good for rheumatoid arthritis, I say there are many herbs which are good. Right. And then we come to, so these are the factors that we are assessing before we decide what line of treatment we will take. And to summarize, we look at additional factors which include constitution, digestion, the excretion, the microcirculation, the exchange between inner and outer environment, and whether vital organs are also involved. So by considering these factors, we would again adjust the treatment for each individual. So in Ayurveda, correcting the, the Agni, or which is called as Koshta, which we can say is corresponding today to what we understand as a microbiome. We believe that we have to do some fundamental corrections in the body so that the body's ability to fight this, the causes, the triggers for this inflammation is activated. So we have to see, in some individuals, we may need to fine-tune the digestive processes. In some other individuals, we would need to, work on their microcirculation, which I will come to now. And, there are certain other concepts like Shakha and Koshta, which actually deals with how the body handles exchange of, nutrients and waste, at a cellular level. So, waste and nutrients. It means we just scan the body both at a macro level and a micro level, and then do the necessary adjustments for each individual depending on our findings. So now we come to treatment decisions. I try to explain many complex things in a very simple way because of lack of time. For example, this whole slide requires a lot of explanation to understand, the deeper technicalities. But I know that all of you are very curious about what treatments can actually be done. So I want to go into as soon as I can. But the thing is that we must realize that just by knowing treatment procedures, we cannot apply them effectively unless you also know the logic behind using them. So we need to study first about doshas, its stages of ama, Those things need to be understood before this treatment will make full sense. But we are not able to go into those details, but I will try to explain as simply as possible. So, for example, if I say that you need to know that there is ama in the system and whether the ama is mobile or immobile, then you may not understand what I mean. Because for that you need to first understand what we mean by mobile ama or immobile ama or hidden ama or So these are concepts which I will not be able to explain now. So the first decision that we have to take in a patient who comes to us, whether we need to do what we call in Ayurveda as a cleansing treatment, or we can go for conservative management. So this means we have to assess the quantum of the dosha and ama involved in manifestation of the disease. The quantum, the quantity.
Quantity.
There is a quantitative assessment of the ama that has to be done. So we need to have some sessions on how to determine whether there is ama in the body and how to quantify it. Now this is another topic. You need a seminar on ama to be able to, because we may have read about ama, but to understand it clinically requires some explanations. So if the ama is high quantity, quantitatively at a higher grade, then we have to do cleansing therapies. And may I ask you a question? What have you understood by the word ama?
Maybe acute inflammation.
So this is the thing. There are many fundamental things that need to be explained. I mean, hopefully we will have another program in April where we will look at some fundamental things. Before going into the clinical aspects, we need to get an understanding of some of the basic concepts in Ayurveda. And ama is a very, very important thing. So ama is actually an incompletely transformed, entity in the body. You can call them as metabolic byproducts, which may combine with other substances and produce, many antigens. They may function like, endogenous antigens in the body, or they may interfere with natural, metabolic processes. But these are substances. The connection between ama and inflammation is that ama may trigger an inflammatory response. And so what Ayurveda says is ama is something which has stopped transforming. And if you can reactivate your metabolism, and then the transformations will complete, and then the cause for the inflammation is eliminated and the inflammation will automatically come down. So this is, we don't target inflammation, we target ama as the cause for inflammation. So we can eliminate that excess substances through a cleansing program. So we have to decide whether the patient needs it or not. Not everybody will need it. So we check the patient and say, okay, here is a person with high ama, so go decide. Go to the cleansing room. So it's not easy to assess ama, and I'm not going into those details now. It's like you have to weigh how much ama is there in a patient's body, and it's not a physical thing that you can do. It requires a lot of clinical judgment and analysis. These are the clinical skills required in Ayurveda. And we also need to know whether the ama, the body is trying to throw it out, or whether the ama is sitting stable inside. So these signs are also there in patients. So we see one patient and we say, not only there is ama, the body is already trying to remove it. If the body is already trying to remove it, then we can give just some facilitation and that process can be completed. Okay. So what I was saying is that when there is ama in the system, we have assessed that there is high quantity of ama. We have to still make further assessments that whether that ama is ready to go out, it means the body is already trying to throw it out, or the body is not doing anything. We have to first wake up the body and tell it, now come on, take the ama out. So in some people, we have to give the treatment to first activate the body before we can remove the ama. In some others, we can directly give the treatment. So in one patient, I might give a medicine which immediately removes the ama from the system. In another patient, I might first do some preparatory treatments before removing the ama. And in some other patients, I will not remove any ama. I will just burn the ama by giving medications, internal medicines. So that we assess ama, we assess its quantity. There's actually a very detailed scheme in Ayurveda on how to deal with ama, because that is not explained. And I don't know whether you have already studied about this, the classification of ama. And so unless we know that concept, it will be difficult to go into all the details. But I hope we got a general idea of how and why treatments are different for different individuals. These are the common methods used for biocleansing in rheumatoid arthritis. And these are, one is of course bloodletting. We use medicinal leeches to do this. So we have done studies to show that, especially in diseases like Pitta, Kapha, Vata, Rakta, where there's a lot of local swelling, if we give even internal medicines, it doesn't easily go away. But if we first do bloodletting and then give the internal medicines, then there's very quick resolution of the swelling end. And this is very helpful in Kapha type of Vata Rakta, where there is localized accumulation. And we have to be careful when we do this in Pitta types. In Pitta people, if you do too much of leeching, it can cause excess bleeding, it can cause inflammatory reactions. Now this is the most interesting aspect of Ayurveda. We never say that leech is a treatment for the disease, because even in a patient, with all patients of rheumatoid arthritis, cannot be administered leech. A lot of patients develop reactions sometimes when we give leech, and especially the Pitta dominant Pitta people can have severe reactions because the blood is already moving and there is high inflammation, and even the leech can sometimes trigger some allergic reactions. And they can get into a lot of difficulties. So for Pitta type, we will give what is called as Virechana. And because Pitta's mobility, the doshas are circulating, so we can bring it, it's easier to mobilize it, bring to the alimentary tract and eliminate it, and not locally removing it. So in Pitta, we have another method of Virechana. And Virechana is not simply giving a laxative. It's not removing things from the stomach. It's bringing things from the rest of the body to the alimentary tract. That is the important aspect. If that part is not done, if you simply give a laxative to these patients, there won't be any effect. We have studied that also. So actually we are using the alimentary tract to filter, substances back into the alimentary tract and eliminate. There was a recent study published in Nature, one of the Nature journals, by a group of scientists in USA who found that when we do Panchakarma in Ayurveda, there is a profound systemic change. The whole blood chemistry is changing radically. So this is published in Nature. Now let me ask this question. Suppose you get a patient, because that's what you get a Pitta type of Vata Rakta patient here, and you decide that they have to do Virechana. What will you give? Because otherwise, how are you going to treat? You have a patient right here in the hospital, and after attending the seminar, you decide, yes, here is a Pitta dominant Vata Rakta, I have to give Virechana. What will you give? What's the common medicine used here? Triphala. Triphala is not a Virechana. It's never to be used for Virechana. Because the problem with Triphala is that it causes excessive dryness. It can cause erosion of the mucus in your intestines. if you don't use triphala carefully. So what else? I mean, any other herb, or what would be used in modern medicine, for example, for laxation? Castor oil. So, or some chemicals which may irritate the colon and cause some, so we have studied the difference between ordinary laxatives and the medicated laxatives. And you can see that when we give Ayurvedic Virechana drugs, it's not simply cleansing from the alimentary tract, but, a complete cleansing of the whole metabolic system, which is what they found in nature, that when you do panchakarma, there are changes in your blood chemistry. And then we do, for Vata type of Vata Rakta, we do medicated enema, which is again not the enema that is done to, there's a more complex action in the Ayurvedic medicated enemas. I will explain that. So here also there are many theories of how this medicated enema works. So because these fluids through the intestines can bring some osmotic changes and exchange of materials, that's one theory. That it will also bring about some changes in the gut microbiome, that's another theory. And a professor is actually working on this, on the effect of Vasti and balance of the microbiome. So what I mean to say is that finally, what is most important is that the right formulation has to be used to get the effect. You cannot simply put some soap water and say, Vata, nothing will happen. Because these medicines, these formulations are designed to have systemic effect, not just local effect. And that formulation is the key thing in the success of the treatment. So how to formulate a Virechana for Vata Rakta, that's another topic. And there is one medicine which is also one of the ingredients of Triphala, which is called Haritaki. Have you heard of Haritaki? So Haritaki is used in different ways in combination with other herbs. It's very good for Virechana in Vata. Have you heard of Dashamula? Yes? So there is a formulation called Dashamula with Haritaki. So this is a formulation which can do the systemic scavenging and eliminate. So we can see that if we do this treatment for about 10 to 15 days, then the severity of the symptoms. So just by doing this cleansing, you can reduce the intensity of symptoms by about 50% without the need of any anti-inflammatory or, any painkillers or steroids, so this is a clinical experience. So Ayurveda does an inside-out approach. We start from internal cleansing and balancing the body from inside, not from the outside. So this is what I already explained. So, okay. So as we do the internal treatments, this is external?
Yes.
Yeah. So we also have to do external therapies. See, when patients come to us, our first goal of our treatment is to make them to stop using anti-inflammatory, steroids, so that they are comfortable without the need to use these. So we do a combination of internal cleansing and external therapies, and by the end of this treatment, we stop all the pain medications, and now they are able to manage without. That's one big milestone, because now the side effects of steroids, the side effects of painkillers, these can be eliminated. So we do some what is called as dhara. This is a specialized medicated liquid which we pour around the joints in a particular way, and this requires some knowledge of the marmas and the pranic flow, So those who know Chinese medicine can better understand the logic behind, flowing in a particular pattern. We pour the liquids, so it's like a mild acupressure also. Because we believe that if you touch a patient with ama, there is some energy transfer to the person who touches. So in the first stages, you can see the pouring of the liquid also produces some pressure stimulus on different parts of the body. So let me ask a question. Let me ask a question. Do you think it will be possible for you to do all these things here? Or do you already think that this is only for, stupid Indians who are sitting there? No, because the challenge is we have to make these formulations. So we have to make a special liquid called dhanyamla, which is sour grain water. We take some grains and we boil the grains and allow the water to become sour. There's a specific proportion. We have to keep it under constant heat, and that liquid is actually to stimulate the microcirculation. We're actually stimulating prana, and it is to be done in a particular sequence. There's a special vessel to pour this liquid, and from a specific height, so that the pressure when it drops is regulated. And this treatment is done for few days. So once the dhara, this is the dhara, and next we have some medicinal pastes which we apply on the joints. And again, the formulations differ depending on the dosha. And they are all like transdermal patches in modern language, which we apply on the joints. And after that comes abhyanga or oil. So this sequence is important because we have to first improvise the circulation, then reduce the inflammation, and then only the oils are applied outside. It's like making the oil body ready to absorb the oil. So that these steps one by one is very important. So the same oil, if you apply without preparation, it can sometimes, cause further accumulation, inflammation. So you can see the paste application, an example. This is the dhara with different substances. And this is abhyanga or application of oil. And these are some sudations, heating with specific herbs and oils, which are done again to mobilize and clear the joints. So this is the first phase of the treatment, which includes a combination of internal cleansing and external therapies. So within a period of 2 to 3 months, we are able to withdraw the patient completely from allopathic medications. But if we stop treatment at this stage, we find there will be recurrence. And we have seen that patients, their ESR and other acute phase reactants, get reduced by half during this treatment period. But after that, they have it again, the whole process starts. So there is that key disease process which we have to still work upon, and that is done in the second phase of treatment. So the next phase, we start giving internal medications. So is this up to here clear? Okay. So in the second stage, we are trying to bring the stability of the internal doshas, prevent the production of ama, and completely break this process, which is now under control. So we need to use these are the medicines that are used. These are again herbal formulations. And amongst the herbs that are used, a very important medicine that is used for controlling inflammation in this stage in Ayurveda is called guduchi or Tinospora cordifolia. Have you heard of guduchi? Yes. And then another herb that is used is gugulu. So we have a formulation called Yogaraja gugulu, which is used on a long-term basis now to prevent the residual inflammation. So in the second phase is predominantly internal medications, to correct the metabolism, immune system, the inflammation. The first stage is cleansing from internal and outside. And in this stage, you can see the patient balance the, work against the inflammatory processes, root out all the triggers, which causes the inflammatory autoimmune responses. So in the first stage, we manage the effects of that inflammation. We clear the joints. So what happens is joint clearance. In the first stage of treatment, when we remove all the doshas, the joints become clear. There is better circulation, better flexibility, because all these treatments help the patient. The morning stiffness will come down, and when the system. So all that is controlled in the first phase of treatment. In the second phase, and the causes behind, we are looking at the internal mechanisms which we have to correct to ensure that this process will not be triggered again. So it includes correcting the metabolism, modulating the inflammatory response, as well as modulating the immune system. Because Ayurveda says that the real success of the treatment comes only when your immune system is again balanced. So that is the last goal. The third phase of the treatment is what we call as a rasayana, which is targeting the immune system. And so this is the third phase. But in actual practice, what we have found is that, it's like trying to clear a water full of weeds. We clear the water, and when we come back, we will find that the weeds have come again. So we say that the emergence of doshas in the body is like that even if we do one cleansing, when there are seasonal changes or dietary, fluctuations, this happens again. We have found in our hospital, we have a 3-year program for rheumatoid arthritis, 3 years. So every year we repeat the 3 steps once, and by the third time, so this is called as iteration. This is what is, it's, in computers, you talk about iteration, repeating the same process till the optimal result is obtained. So Ayurvedic treatments have also to be applied through a process of iteration. So we found we optimized over a period of 3 years. When we repeat this, we are able to induce a remission. So there is no magic. So by doing this process of cleansing, regulation of the metabolic and immune systems, and then finally a rejuvenative therapy, by repeating it 2 to 3 times, then we are successful in inducing remission in a large number of patients. So these are some of the types of dosage forms of herbs which are used in the management of rheumatoid arthritis. So there are pills, there are powders, there are decoctions, there are fatty extracts, alcoholic extracts. So we have to use all of them in various combinations according to the stage. And all are not used in everybody. As I told you, depends on the type of dosha, the constitution, the stage. Now to come to the practical aspects of it. Now if you wanted to implement this protocol here, I'm going to tell some of the specific medicines also now. But before that, I want to just discuss an approach that could be made practical here in the future. The most challenging part, which was also mentioned by Dr. Oleg, would be to have specific formulations. Because in Ayurveda, so you have a certain number of herbal formulations available here, which can be used for ama mobilization. And these are simple formulations. The first one has only 3 ingredients. So just like in Chinese medicine, we have raw materials which we combine and give as herbs. We could create a system here by bringing, instead of the final medicine, we can bring maybe 15-20 herbs for rheumatoid arthritis, and then learn how to combine them according to different patients. So identifying a list of such herbs, finding out which ones are available here already, which ones may need to be brought outside, is a practical step without which we cannot think of implementing these treatments here. And first step would be to use herbs which are already used in India, and then eventually find substitutes for them here by experience. It cannot happen in the first step. So this is the essential drugs list which we developed through our clinical trial, which are needed anywhere in the world to do treatment for rheumatoid arthritis. So these are those formulations. And I would suggest that instead of buying finished products, because there are more regulatory restrictions when you want to bring prepared medicines, the better thing would be to bring raw drugs and then make the medicines here, because then it's easy. Because these are like pharmacy preparations. They can be done in a good, pharmacy kitchen, which could be established, and then those medicines could be prepared, and it'll be much more effective than, shipping finished products. Okay, so these are all the various formulations. So given different stages of the disease. So these are some of the rasayanas which we are giving in the later stage. And I will show some pictures also of these plants. And then there is the diet and lifestyle modifications. And we have found that to prevent recurrence after the 3 years of treatment, diet and lifestyle restrictions have to be continued for many more years. So now I would like to just have a little bit of interaction, just to sum up what we discussed. Let's start with the diagnosis. I would expect your response just to, make sure that we are on the same wavelength. So what is the name of the disease in Ayurveda is closest to rheumatoid arthritis? It's Vata Rakta. Okay, great. So excellent. So you seem to have studied a lot of Ayurveda, looking at the fast responses. So that's the first step. And in Vata Rakta, how does Vata Rakta relate to rheumatoid arthritis? Is that a one-to-one correlation? It's broad, yes. So rheumatoid arthritis is just one type of Vata Rakta. And so we need to, in our diagnosis of the patient, we don't look at whether it's rheumatoid arthritis or not, but we look at whether it's Vata Rakta specifically in the joints, and that is our treatment protocol. So this is strictly not a treatment for rheumatoid arthritis. So if a patient presents with very prominent swelling, more swollen joints, and not so much pain, what would you assess it as? What type of dosha? So what type of cleansing therapy would we use? Jesus. Great. So we can already start doing the treatment. And now we have a patient who is extremely red, burning, and tender joints. What type of dosha? Pitta. And then what type of cleansing would be needed? Virechana. So, and now you have to choose the right Virechana medicine. That is the trick. Yes. So why do we do Virechana in Pitta and not leech? Yes, it's because Pitta is already heat, blood is already, it's not localized. So two things. One is, it will not be enough to remove it from a location. We need to bring everything here and remove. In Kapha, it is localized. So, leech is effective, but not in Pitta. And if it is, a patient with, easily going to get deformed joint, his Vata. But there are shades in between that I did not go into now. There's Vata Pitta, Pitta Vata, Vata Kapha, Kapha Vata. So, but it's okay. No, it's not difficult. It's difficult if we try to learn everything in 2 hours. But it's not difficult if we learn it in a clinic at the bedside over a period of 6 months. We will become experts because we already know, those of you who are medical doctors are observing it every day. So once we see the logic of the doshas, then it's very clear that if you see the dosha here, this is the treatment, this is the herb, and then it's very easy. So if there is a kapha type of, swelling externally, I did not fully explain, but I want to know whether you can use the logic. What would you do? Would you, do dhara, or would you apply a paste, or would you do abhyanga? If it is, swollen, too much swollen, because what will happen to the dosha? Is it moving or not moving? So what can you do? The ama is not moving. So what will be effective to make it move? Something to make it move. Is it dhara? Is it dhara or paste or oil? See, we discussed that the purpose of dhara is to make the prana flow. So you will need to do dhara to make it move. You will need to do dhara to make it move. And if it is really very, very hard and not moving, then you have to do that bang, bang, bang. So we have that. This is logic. Actually, it's very logical. This is just understanding how the body speaks to you. We say the doshas speak to you through the symptoms. So kapha says, yeah, it's me here. I'm slow. I'll not move. And then you say, no, you have to move. Push. So you're actually conversing with your own body. I mean, that's the language of Ayurveda. And Pitta says, I'm angry, I'm heat, I'm going to burn your joints, and and then you will put some paste. Oh, cool down, please, cool down, cool down. And then if it's Vata, degeneration and destruction, they will put oil, because then Abhyanga. Abhyanga is for Vata basically, and not for Kapha. In fact, Abhyanga should not be done when there is Kapha. So, but these logics will become clear when we do some fundamental principles. So, study of Ayurveda is in two phases. One is study of fundamental principles, and the other is its clinical applications. Thara is for kapha, vata kapha. It is to make things flow. It is to make things flow. It's not exactly for kapha, it's usually for vata kapha. If it is just kapha, then you will do the swedana, which means the pinda swedas, so to physically clear the kapha. Pure kapha requires not even dhara, it needs even the pinda swedas. This kind of swedana is needed. These are general principles,
And then can you repeat for vata and...
Yeah, so for vata we have to do abhyanga. And for pitta we may do some mild lepas. But again, we can do an abhyanga for kapha, but we have to change the medicines, make it very hot. So when you use an oil for kapha, you have to use medicines which are very powerful. So there are many ways in which we can adjust the medicines for specific doshas. So we can have actually a clinical training, in this, by how we should do it is, now when you see a rheumatoid arthritis patient, you forget about rheumatoid arthritis, you look at, is it Vata Rakta or is it Amavata? I mean, what is the presentation? Next time our rheumatoid arthritis patient comes, please try to find out whether it is Pitta, Vata or Kapha.
Постарайтесь выяснить.
Just note down the symptoms. Note down the symptoms.
И запишите симптомы.
How many swollen joints, what is the swelling, what is redness, how much. See the variations. And if you do this for 20, 30 patients, then the 31st patient, even when he starts coming into your room, Vata Rakta. The second one is Pitta Vata. It's very easy to identify. So we need to have a practicals of, examining 30 cases of rheumatoid arthritis, classifying them into the doshas, and seeing the distinction. So you can see in a population of 30 patients, how many are Vata, how many are Pitta, how many are Kapha. And then you can see the combination. So this is the way to learn it. And then when you start using the treatments,
уже...
When you begin to see the results, and then you will believe that doshas are there. So it's only through clinical things we can show it. And we could do it also in a trial, where, it was very clearly demonstrated that this works. So there are in Ayurveda methods of early detection, prediction, various factors. If the person is following certain diet and certain behavior, we can predict that he's likely to develop rheumatoid arthritis. Certain constitutions, now we know that ACPA is positive 3 years before the patient develops rheumatoid arthritis. In a similar way, in Ayurveda, there are some subclinical symptoms which are described to detect early Vata Rakta. So I just wanted through this slide to show how Vata Rakta is broad spectrum. It includes not just rheumatoid arthritis, but many of these diseases, including thromboangiitis, obliterans, Raynaud's phenomenon, many vascular diseases, which like varicose ulcers. If you do the treatment for Vata Rakta, it responds much faster than simply treatment for ulcer. And here is a treatment algorithm. This was the last slide for rheumatoid arthritis, and I think it is up to 2:15, according to the schedule. Some more time. So because I thought I'll show some of the treatments, how it is done, and then some of the plans, so that you get a feel of what is being done. But is the overall approach, is it clear how we do, how we diagnose? So I hope I was able to explain how Ayurvedic treatment is individualized, and what parameters it is individualized, and how those decisions are very, very crucial. So if you ask whether leech is good for rheumatoid arthritis, what would you say? Depends. Everything is that way. So when the rheumatologist asked us, which is your best treatment for rheumatoid arthritis, we'll test it. We said we have many best treatments. So this was a snapshot, very simplified, because the algorithms can be a little bit more complex when we take into factor the subclassifications of the doshas and ama, then it will expand. But I want to convey that it's not difficult, because in the 2 hours we could bring the basic logics clear. You could also, in the interactive thing, kind of predict what type of Vata Rakta is what and what treatment should be done. So with little effort, this is very much doable. So these are the physical external treatments. And as I said, the main goal of these treatments is to precipitate doshas, bring them from the periphery to the koshta for elimination. And as I told you, there's only one study which is recently published in Scientific Reports of Nature, which shows that these procedures have a systemic effect. There's only one study giving an indication of those changes. It'll be interesting to read that. But otherwise, it's an Ayurvedic theory. I mean, this is has no counterpart in modern medicine. There's no idea that you can bring things to the koshta and remove it. It's a unique Ayurvedic understanding, but now we're beginning to get a handle of how this might be working. And so one is snehana, or oleation, application of oil. So the body is saturated with fat. High doses of fat is given. So it's very similar to, I think, Atkins' diet, which was, but it's not similar. Ayurvedic thing is, that is a very generalized, and now it is also being criticized for some similarity because of high emphasis on high fat. So oiling can be done as simply applying oil outside of the body, or by drinking ghee, even 500 ml of ghee in one go. Just drink 500 ml. So it's done over a period of 7 days. And Abhyanga is the simplest way for snehana. And with Abhyanga, the most important thing is Abhyanga should not be done when there is ama in the body. One of the biggest problems with Abhyanga in Ayurveda is that today it is done without adequate preparation. And actually it causes harm than good. Abhyanga should not be done when kapha is dominating. So if you see a person, you can immediately decide whether Abhyanga is needed or not by a checklist. Kapha is there, ama is there, no. Even if pitta and rakta are dominant, Abhyanga is a problem. Why? Because Abhyanga causes heat to be trapped inside. It causes blockage of the srotas. It can increase inflammation because heat will be trapped inside when you do oil. So in these conditions, we should make sure we do not do Abhyanga. We should do Abhyanga only, ideally, only after the previous meal has been digested and you have had a bowel movement. If you have not had a bowel movement, that day don't do Abhyanga. You may say, what will happen? If you are asthmatic, your asthma will increase. You may get skin allergies. And many people will say it's the oil is a problem. So it's not the oil, it's because there's ama in your body. So you may get severe, if you apply oil on the head when there is ama, you can get redness of the eyes, sneezing, runny nose, headache, all these problems.
Yes.
Because of the Ayurvedic spas, a lot of people are doing Abhyanga in the wrong way. When you do Abhyanga, the entire channels in your body should be open and ready to receive. No blockage. So that's why after previous food is digested, you have eliminated the bowels and you're beginning to get hunger a little. There should be a little hunger when you do Abhyanga. What I wanted to say is that each of these procedures has an SOP, means standard operating procedure. You have to follow those guidelines to get proper results. So, for example, before a patient comes to you, we need to do a checklist and really recommend. So in Ayurveda, we have a Panchakarma expert who will check the patient before posting them for even Abhyanga. If he finds any of the checklist is wrong, he would say not recommended today for Abhyanga. So when you bring that protocol here, you must have a specialist checking every patient. Just like for surgery, you might decide, okay, his surgery, you have to do that, and otherwise you will not get the results. Second thing is choosing the right oil. So if you use a pitta oil for a vata person, or a vata oil for a pitta person, or the most danger will be if you use a kapha oil in a pitta person, then it will be too hot and the pitta. So Abhyanga is okay, he's fit for Abhyanga, and I had only this oil, so I used it. And now his heat body is completely gone, so it's because you use the wrong oil. So only when everything becomes correct, you will get the result. And many people ask whether we can use only sesame oil, because only that's available, or can we use olive oil or mustard oil? It's, each one of it has a different effect. So we must know what is the effect of olive oil on the doshas. What is the effect of sesame oil? What will happen when we add another herb? So without understanding these, you cannot. So can you tell what effect will be there for olive oil? Mustard oil? So which dosha? Kapha. That's very easy. So in this climate, mustard oil is very good, but not in Kerala. So Siberian Ayurveda will be disastrous in Kerala. And Kerala Ayurveda will be disastrous here. So olive oil, so you'd like to stop now? Because I had only a few more slides to show. 10 minutes. 10 minutes, that's fine, that's fine. Okay, so I did not have the coconut oil for pitta, yes. Olive? No, it doesn't have to be described, we have to understand. So when you use it, it's vata pitta. It's pitta, vata pitta, olive oil is helpful. And it's correct. So you must be able to understand the properties of the oils that you're using, and then you can use it correctly. So there is a method of apply oil. There's an elaborate protocol. So what I wanted to say is that if you don't follow all these protocols, you will not get the results. So it's not just deciding that Abhyanga is good for vata, but we must also follow that we choose it in the right way, with the right medicines, the right procedures, There are methodologies described. Okay, I was just moving only my slide. So, see the materials, the timing, the positions of Abhyanga. This is very detailed. So you can have a simple application to specialized manipulation, even working on the pressure points. So Abhyanga is very complex. They are very simple to very complex methods. So in Vata Rakta, for example, you cannot use very harsh Abhyanga because the joints are very delicate and inflamed. So there are special Abhyangas for special diseases. So relaxation is needed before and after. As I told you, it is to cleanse the alimentary tract before Abhyanga is done, and after, because a lot of materials will come to the alimentary tract after Abhyanga, and to eliminate that we have to give it's only laxation, not purgation, a mild laxation too. So how do we know whether Abhyanga has been done properly? So you can see a lot of symptoms. So after each Abhyanga you must make a note whether you got the desired endpoints. If after Abhyanga the patient tells these symptoms, then there was something wrong with the way you did it. So this means we need some training to do this correctly. There are so many precautions to be done when you're doing it. So there are some colorful pictures also, Kerala Ayurveda, but it's not as simple as this. Okay, so we have also all other procedures. I'm not going into it. I just want to show you that for like Abhyanga, each and every procedure has all these protocols. You can imagine I never had the hope I will explain all this today, but I wanted to show that there is all these details which we need to get into. So we go to the plants used in musculoskeletal disease. The next slide. This is a herb. Can you recognize? No. This is called Gokshuda. Tribulus terrestris. It's one of the ingredients of Dashamula. It's a diuretic, anti-inflammatory, and it's very helpful in removing swelling. So you can see it's also used in Vata Rakta. It's used in diseases in which there's a lot of swelling, congestion in the muscle, to clear the congestion. So this is the part that is used, which is actually the seeds, fruits, dried fruits. So these are some of the properties. Again, you need to study each plant in a little bit of detail. In India, we have to study for about 10 years before we can really start practicing. And so to compress all this into 2 hours is impossible. So we have understanding on what dhatus it acts and how it acts and all these specific things. So there are some studies also. I have made these slides to share, not for discussion, so that, based on what was discussed, they could go a little bit more deeper. This is another plant. The Cissus quadrangularis. You can see it's shaped like a bow. It's like the bony joint, so it's called as, a collection of bones. That's a Sanskrit name for this plant. And these are its properties. It's very helpful, in healing bones. So it's an ingredient of preparations which help fast healing of bones after fracture, And here's another herb. This you may be knowing. I think it's there here. Cedrus deodara, a cedrus species. So this is called as Devadaru in Sanskrit, and it's extremely effective in removing swelling from the joints, swelling and inflammation. This is used for removing swelling from the joints, and it's also an ingredient of some of the formulations used in rheumatoid arthritis. This maybe you know it for sure. This is castor. So castor leaves are used for swedana. Castor leaves, the leaves are very good for pain and swelling. And here is another plant called Rubia corifolia, very good for inflammation and used in rheumatoid arthritis. And then here is Vitex negundo. This is especially good for lumbar spondylosis. It's called as nirgundi in Sanskrit. And this plant, this is Piper longum or pipali. It improves absorption of medicines. It increases the bioavailability. Yes, so I go quickly. This is a plant very good for relieving spasm. It's called, Padaria foetida. This plant is very good for relieving muscle spasm. And then Tinospora cordifolia, that is anti-inflammatory and immunomodulatory. Recently, a recent study has shown that Tinospora cordifolia can prevent the side effects of chemotherapy. And this is used also in rheumatoid arthritis for chronic inflammation in combination. This is a very important plant for giving strength and stability to the neuromuscular system. This is called as bala in Sanskrit. And it's one of the famous formulations is Chirabala. Chirabala is a very famous formulation. And then this is, of course, hope you know this plant, Ashwagandha. And that's very good for rehabilitation. In the rehabilitation stage, where you restore your functions, stamina, recovery of musculoskeletal diseases, Ashwagandha is used. Sisera indicum is very good for bone remineralization. For black seeds we use. There are special preparations for bone health. And so, that's it.